Hi everyone. I'm so glad that you are all here and feeling a little bit warmer and enjoying the end of a really incredible day here at the Century Summit. So I am Donna Griffin. I co-founded Eldera, but now I'm going to introduce my incredible panelists, which I'm so excited about. I got to meet them before this panel. So first, I'd like to start with Dr. Katherine, the founder of Neolth. And Dr. Grill has had an incredible career already, and I'm so excited to get to know her because I've been following her on LinkedIn, and she gets an award every week. So I encourage all of you to follow her. Absolutely. So what she focuses on is the preventative work, actually creating preventative tools in school for mental health for young adults. And it's incredible. And she was recognized by Forbes on 30 under 30 for education and childhood development. And she was recognized by the World Economic Forum for the product that she created. So I'm super excited to have her here. And I'm going to ask her some very pointed questions in a moment here. Next, we have on the screen joining us, Dr. Azizi Seixas. And he's an assistant. Did I say it right? I see you smiling, and I hope I did.
That's
Thank
correct.
you. Okay.
That's correct.
He's an assistant professor of population health and psychology at the University of Miami, and he really focuses on the social determinants of health. He works across mental health for young adults and older adults. And he's incredibly versed into our current challenges, but also what is possible in the future if we do the right things. And welcome. And finally, Dr. Michael Enenbach. I'm so bad with names. I apologize.
Right.
It's been
Enenbach.
Enenbach. Thank you. So Dr. Enenbach is a senior director at the Child Mind Institute. He really focuses on obviously the mental health of young adults, a combination, from what I understand, of psychopharmacology, behavioral health, and very interesting interventions there. And he comes from the University of California, LA, where you spent the last 12 years there. So, we talked a little bit about the mental health of young adults, but if you're not familiar with the current situation, we are currently experiencing the worst mental health crisis in young adults ever. 45% of high schoolers are so hopeless today that they can barely function in their schools. 75% of high schools report their biggest challenge being the mental health of kids. At the same time, schools in all 50 states failed to provide adequate support for kids, not for any, misgivings of their own, but they just don't have the resources to do so. So we reached the boiling point where we absolutely have to come up with both preventative and clinical solutions to this incredible health challenge. So I'd like to start with Azizi first, because I would like Azizi to explain to us a little bit of what he's seeing of the challenges. How are the challenges defined, and what is the current state of the mental health of the young adults?
Sure. Well, thank you so much. I hope you all can hear me. My huge apologies for not being there. And let me just kind of say a little bit about myself. So I'm associate professor and founding director of the Media and Innovation Lab here at the University of Miami School of Medicine. And so I wish I were there with you all. And one of the things that we are, really intently focused on in trying to tackle, not just in terms of youth mental health, but in general mental health and overall wellness, is that here's what we're seeing. What we're seeing is that approximately before the age of 25 years old, that 75% of mental illness will rear its head. It will manifest. And what we've also seen is that because of COVID, and I think in previous panels, it has been acknowledged that COVID has really spiked the level of mental illness issues and mental health problems that we see, where particularly racial ethnic minorities and women, particularly girls, are most affected. And there was a spike of over 50% of these individuals who report suicidal ideation, or at least had to, be admitted to the ER for this. So what we do here at the Media and Innovation Lab is to look at a socio-ecological model, looking at interpersonal, community, policy-based types of interventions and programs. And what we've done is that we've tried to align ourselves with community-based organizations here in Miami, particularly in underserved communities, and try and find ways to co-create programs that will allow us to meet these parents, meet families, meet teachers where the needs are. So, we're currently working with Neolth, with Dr. Grill, leading one of the largest digital mental health programs in the entire state of Florida. We're going to be reaching to about 7,000 middle and high school students, building 3 particular key areas. One is training teachers and guidance counselors to be able to identify mental health issues, finding ways they can triage that and seek the necessary care. Second, increasing access, because that's a huge issue. 68% of families live in communities in Florida that are not close to a mental health provider, and we want to be able to increase access through digital solutions, and we're providing that through our partnership with Neolth. And 3, we want to be able to create a website, a comprehensive website that not just only provides information, but also creates opportunities for us to help families to deal with social care navigation. So those are kind of the issues that we're trying to tackle: multi-level determinants of mental health, particularly youth mental health, and trying to find accordingly multi-pronged approaches of addressing it and using digital solutions to increase access.
Thank you, Azizi. I want to take it over to Katherine now, because Katherine has built an incredible product, and we heard a little bit about it from Azizi, but I want to go a little bit further, and I want to ask you, what made you build this product? What's the story behind it, and how did you get here?
Well, like many people who work in mental health, it's usually a personal journey. And I say my story is many years in the making. I grew up, I can see you nodding, you must have heard one of my other interviews on LinkedIn. I grew up in a low-income family. My mom was a teen when she first became a mom. She worked as a maid to make ends meet. She was really fantastic. She even started her own cleaning services company, which I think is so cool, because how many teens do that while they're becoming a mom? Like, she's just awesome. But I lived in this family, and obviously there were, financial limitations. There are also limitations around, I think, stigma that really became barriers to accessing mental health care. And when you have people in your family who have serious mental illness and aren't able to access care, as many of you know, that's very devastating. So for me, I think it was something I was surrounded with at a young age. Even going into high school, many of my friends fell into substance abuse and passed away at pretty young ages, and it was very much so swept under the rug. The schools were not discussing it. Nobody was discussing it. So it was just something that was all around, and I realized at a young age, this is a huge problem. So I became interested in mental health. I originally studied therapy in school. I worked in the expressive arts therapies, so a lot of art therapy, mind-body therapies. I worked in some in and outpatient psychiatric care units, and ultimately decided I wanted to go on to get my doctorate in neuroscience, because I was very interested in neurodiversity and personalizing behavioral treatment interventions, and how could we make care matching more efficient, and how could we, especially for people like me who came from different backgrounds, or we're going to talk about with the work we're doing with Azizi, different cultural backgrounds, how can we make sure that that care really meets them where they are? So I worked for a while at Children's National, that's in Washington, D.C. We were doing some NIHR1, so large-scale clinical research studies on adolescent behavioral health, and loved it. Got to learn a lot about building health programs and validating them, but my heart was really in the implementation science and changing things on a societal level, doing these programs at scale. So, long story short, it's been about 5 years. I moved out here. I quit my job. I had no idea what I was going to do. I just moved out here. And now some years later, I'm running Neolth, and it's just been a pleasure to work with people like Dr. Seixas, and really get to work in the communities and serve these kids.
Fantastic. Thank you for sharing that. I think each and every one of us are here because we have a story like that, don't we? So it's important to hear the stories behind the solutions that are being created today and hopefully in the future. And that takes me to Michael. So Michael, can you share a little bit more about your work at ChildMind and really what brought you to that work as well? What's your story?
Yeah, so I'll start with my story. I grew up in the Midwest. I was one of those kids, like in second grade, I was like, I'm gonna be a doctor. I was just that, and I didn't know why. That's what I wanted. I went to college, was pre-med, went to med school, liked the study part, and then I was really disillusioned with a lot of other areas of medicine. And so I found psychiatry, which was a savior for me. I just loved it, and getting, having intimate conversations with patients about, their mind, their depression, their anxiety was just so fulfilling for me. So I did psychiatry. I came out to UCSF to do my residency. I worked as a mobile crisis medical director in San Francisco for 2 years. And then I got kind of burnt out talking to adults. And I knew I wanted to go into child before, but it was just burnout in general. I'd been in school so many years straight. So I went back and did a child fellowship. So I took an odd approach, but and that was at Seattle. And then I was on faculty at UCLA for 12 years. And then ChildMind, I was recruited for this organization. And I was familiar with the organization from New York. They have like 250 employees in New York. We're kind of a startup. We opened in 2019. We have like 15, so different. But yeah, I mean, we're a national nonprofit dedicated to improving the mental health of children and their families. So we provide psychiatric care, therapy, everything's evidence-based, which I really value. And we're all under one roof. So it's like the psychologists are right next to me, next to the social workers. So it's just like so easy. Like at UCLA, I was like, you need a therapist for CBT, good luck. Like there wasn't anyone for me to send them to. So that's another part I really like about this job. But yeah, it's been really fun, and building our practice, and the kids are amazing. Such diversity of different kids that come in too.
Fantastic, thank you. So Katherine deals with preventative care, and then when that doesn't fully work out, then Michael and his organization jump in. But there's something super interesting about how Katherine built her product. In fact, there's the voices of your users are embedded in the product. Can you tell us a little bit about that?
Sure. Yeah, when I was running some NIH research studies back at Children's National, I had the pleasure of training under a doctor who was very big on community-based participatory research. So I learned early on that it's very important to bring in the people that you're serving to the kind of conversations and design sessions, and just make sure that you're really meeting them where you are. I think sometimes as clinicians, we think that we know from our training how a program would work or how a patient would act, but really it's important to make sure we ask them. So as we were building up Neolth, and really a lot throughout 2020 was when we started. We launched out of UCSF. I got to take their Startup 101 program, which was for scientists who wanted to become entrepreneurs. And we were building up, we had this MVP, we were building up the product. And this really funny thing happened. And this is why I love working with teens and young adults. I started getting a lot of emails. I don't know how they found me, I guess LinkedIn, but I started getting all these emails, and they're like, Dr. Grill, I really like what you're doing. And it wasn't just, can I use the app, but it was like, can I work at your company? And I actually had 700 kids that year email me asking me to work at my company. And of course I couldn't hire them all. I mean, we didn't even have funding at that point, but we wanted to include their voices in what we were doing. So my team is fantastic. I'm very proud of them. And they thought up this idea, well, let's build up an ambassador program. Let's create a virtual internship, especially during 2020 when all the schools were closed. Let's connect these kids throughout the country, give them peer support, give them the space to talk about mental health, and really learn from them and give them the opportunity to build up a product in partnership with a technology company, which doesn't always happen. So we were really fortunate in that I think given everything that was going on, there was a great need for this, that the kids saw that, and they kind of raised their hands and stepped forward and said, can we work with you? And my team found a way to incorporate their voices. But that's huge, because I think not only does it help with keeping you on track with the mission, keeping you up to date with the students and their real needs, but when you look at things like the engagement in a product, which then translates to the clinical efficacy, you really need that strong engagement. And that's what we've been able to accomplish at Neolth through working with these young people.
Thank you for sharing that. Many times we think that when we look at a vulnerable population or a population that needs help, we think that we need to do things to them or for them, when in fact, at Eldera as well, we learned that doing things with them is the most successful. So as a parenthesis at Eldera, which stands for the era of the elder, and thank you so much, Martha, for the incredible intro. Older adults are building the company with us from the inside out. And now we have a group of high schoolers who are building with us. And we just launched last week with the 3rd largest school board in the country as a social emotional learning program. And the entire launch there was designed by the high schoolers, because guess what? They know what they need better than me. And older adults know what they need better than me. So it's really wonderful that we can bring technology to serve them when and how they need it, not assume that we know in advance. So I'm very excited to see where that's going. Thank you. Michael, you work a lot at the clinical aspect, and your job has gotten much harder over the past few years.
Yes. Volume-wise, yes. I will say I'm searching hard for silver lining of the pandemic, but it really brought telemedicine to the forefront. Telehealth, it was something that insurance companies weren't covering before the pandemic, and then we kind of forced into it. And I could see patients throughout the state of California, throughout the state of New York, because I have a New York license, so it's really opened up access to me. And I can't speak for other psychiatrists out there, but that's been kind of a blessing. So the volume has been intense and a lot of questions, about the pandemic and how it's going to affect people. But in some ways, my practice has gotten a little easier because I can do a mixture, a hybrid of in-person and hybrid.
And do you feel that the young adults who come to you come from different backgrounds, perhaps a different reach, or maybe even a different understanding of what mental health should look like?
I think that it's still there, but the stigma has improved with mental health. People are talking about it more. Kids are talking about it more. There's a lot of outreach towards, like, high schoolers, they're pretty adept, like, what's going on, and this is what I need, and we do therapy first, and if they need medications, I'll see them and we'll talk about it. So I feel like they're more informed for the most part. Not fully informed, but informed more so than 10 years ago when I started, I would say.
Than what we've seen before.
Yeah.
Okay, I'm going to throw a question to all 3 of you. So we all keep a very close eye on the industry. What are some of the exciting tools that you see out there in addition to what you're working on?
Maybe this Dr. Seixas, if he wants to.
Would you like to jump in?
Certainly. I think I'm missing out on the fun.
I know you are.
I think what we're doing and what excites us is these kind of multi-pronged approaches. But from a technological standpoint, we are really, pushing ahead, not just providing digital solutions. We oftentimes say here in the Media and Innovation Lab it's not just enough to provide the information, it's how you provide the information, the quality of the information, the media through which you provide that information. And so I'll underscore that one point, that we are really getting into immersive technology and immersive experiences such as mixed reality, particularly VR and the like. Virtual reality, for those of you, be mindful of my audience here, not to be too jargony, but we're really focused on virtual reality to provide an alternative interface that can increase engagement and embodied types of experiences. Not only does it have that embodied experience, but what the literature does show is that it can potentially have neurofeedback effects on kids as well. And I think that is the critical piece that I am excited about, as well as other potential areas such as haptics, haptic reality, which focuses on touch and dealing with issues such as phobias and the like. And I think once we start to democratize the interfaces that will likely lead to different mental health practices, then we can ensure that we can boost what we call a precise and a personalized approach. And I know that's something that Dr. Grill has as a motif throughout Neolth in terms of kind of precision and personalized psychiatry. So I think for us, it's the tools that will allow for therapy, the tools that would allow for better data capture that will also increase access.
Sounds great. That sounds great. Any other interventions that you've seen that you like, or perhaps we did not talk about this one, perhaps something that you see clearly missing?
Yeah, I think one of the things that to me I'm excited about, but I see clearly missing is I'm going to talk about it from a systems level approach, but the cross collaboration. It's really exciting to hear, what Dr. Seixas is talking about, all the different types of technology, and being someone even who's working in technology, I can tell you around how our product has developed throughout the years. We've added more, more features. We've started to work more with, the clinical, being able to do data sharing, AI for crisis monitoring and care escalation. So even within products, I think what we've seen on the market the past couple of years is they're starting to evolve to make sure that it's not very fragmented. It's not just prevention over here, clinical over here. How can we make things more seamless? But I'm not the only one building this. There are a lot of people out there building different solutions, and that is creating a fragmented behavioral health market, at least from a technology standpoint. So what a lot of people are predicting in tech is to see more consolidation. Last year, you saw the merger, for example, Headspace and Ginger. So one that was more clinical services, one that was more self-guided. I think that we'll start to see more of that, but I'm really excited to see that, and really to see the merger of these technology solutions and clinical solutions. And Michael would be happy to hear your thoughts on that, because I think that's going to be the key at really solving this, is bridging that gap.
Yeah, I agree. Yeah, I mean, I think that, for me, I'm on a panel with I'm a technophobe, so I see a lot out there, but I probably can't name anything. Like someone had to show me how to use a shared drive the other day. So I figured it out. So I know a lot of things, and we're developing things such as tracking apps to track ADHD treatment, mood, depression. So we're working on things like that through partnership with UCSF with someone there. And the other thing is, I think that from a minimally technological perspective, California started this Healthy Minds, Thriving Kids campaign with a nice grant, and it's really cool. You guys can check it out online. We recorded 5 videos of kids, parents, and teachers, so 5 each in English and Spanish, that talk about their mental health. They're like 5-minute videos. It's really touching. The kids are amazing, and and then teachers, if you are a teacher in the state of California, if you go watch them, you get a $100 grant given to you. So we had a great success with that. So I mean, these are not super technologically, but it's something to get that kind of bridge the gap between schools, parents, providers. So that was really interesting. Good.
That sounds great. Yeah, technology is a tool. It shouldn't intervene with human conversation and interaction. So thank you for that. Before we close up, what I'd like to do is do something a little bit different. I'd like to open it up for questions and then close up on a high note. We have some things about what a North Star could look like amongst us. So I'd like to open it up for questions now for a few minutes, and then we'll wrap it up in a way that hopefully is going to give a little bit of a celebratory mood to this really, really important and dynamic conversation that we're having.
Thank you. This is really interesting. Thank you all. I want to ask why you think depression and anxiety rates are up among high school kids. I think everybody and their mother probably has an opinion about it, but you 4 actually see it firsthand. What do you think are the root causes?
Would like to go first? Okay, I'll give you my theory, and I'll give you my theory as the only non-academic on the stage, but we've been deeply involved in this. So we know that everybody talks about the loneliness epidemic and older adults being lonely. 1 in 3 older adults are lonely. 50% of older adults over 80 are lonely, okay? And that's really bad. What's worse still is that 71% of adolescents are lonely. And when they are, they haven't yet developed the coping mechanisms to deal with it. Because when older adults are lonely, their depression and anxiety is not that very high because they have resilience and coping mechanisms. When kids feel lonely, they become hopeless. They don't have coping mechanisms. And my theory is that that's what leads to the mental health crisis that we're seeing. And that was exacerbated by COVID, but it precedes COVID because they're so tethered to this. That is my theory. That's what we see at Eldera. So the moment we start connecting people and help kids form bonds that they feel are true bonds, they're not filtered through TikTok, we see their wellness go up immediately. So that's my non-academic theory, and that's really what we are actually partnering now with Columbia University to research the health outcomes of that theory, but that's what we see at Eldera.
Okay, getting the nod. I like that approach. I think we see something very similar, the sense of belonging and community, and it's actually something that we built up onto the app. So our app looked very different, as many do, when you first start. And from my clinical background, I've built in a lot of clinical skills and breathing exercises and CBT, and they're fantastic, and I think can be very impactful. But of course, when we started working with the kids, one of the first things they said was, "Where's the community?" Just like that. Where's the community? So we actually built up a section called community, and that sense of belonging, I think, is very important to them. When they're working with me, it might be a little bit different than when they're working with you, but they don't always have that clinical language. So a lot of times they'll talk about things in a different way, but it is that sense of connection that they're missing. So they'll talk about relationships with friends, maybe struggling in those relationships, struggling in relationships with significant others or parents. A lot, I think, around normal development of just trying to find their independence and struggling with that. And then on top of that, you have this overlay of, to be quite honest, technology and social media, and that's caused huge issues, across different gender identities, I would say, with body image. So that's another thing. And then the last thing I hear a lot around is this just enormous pressure to succeed. All the kids we work with, there's a list of the top couple schools that they want to go to, and they feel like if they don't get into those schools, they're a complete failure. Pushing themselves into homelessness, as we know, to be able to attend top schools because they don't have sometimes the financial means. It's a huge problem. So I think we also need to rethink support systems and to an extent rethink higher education, how we can really support our most vulnerable kids.
The incentive systems, the incentives are really misaligned. Thank you. Michael.
I agree with everything you just said. I think that, working on the peninsula, I see a lot of really high achieving kids. One kid right now is taking 6 AP classes this year, and I'm like, and she's acing all of them. So it's hard for me to say, don't do that. That's insane to me. But I see all that pressure. That's certainly there. I think obviously social media has really positive sides to it and really negative sides to it. So like bullying is just so much more intense now with social media from what I see. Like it's not just left at school, it's on your phone all day, seeing comments, and it's just in your face constantly. That's bullying. So it's a lot more intense. And we saw, anxiety, depression, eating disorders all spiked during the pandemic. It was a really hard time for LGBTQ teens because maybe they were out at college and college shut down. And now they're back at home and they're not out to their parents. Little things like this, and they don't have the support system that they used to have. So it was interesting looking at the statistics of sort of what got worse. Some things got better. I had kids with social anxiety or autism who just hate going to school, and they love just looking at a screen. So getting them back to school was really the challenge after 2 years. So, there's pluses and minuses, but there are a lot of stress.
If you don't mind, may I chime in, please?
Yes, please.
I'll bookend our comments because I know you mentioned that you're the non-academic, but I think your points are quite astute, and I'll provide the very academic approach. I think there are two things. One is what we've seen, not just here in Florida. I know it can be quite a contentious issue. I don't want to get in trouble, but we've seen a systematic gutting of social and emotional learning programs in our schools. And not that we should conflate social and emotional learning with mental health, but what the research does show is that, the improvement or the increase of social and emotional learning can act as buffers for long-term or potentially subsequent mental health issues. So that's the first thing. But in terms of how, to answer that person's question, you have to look at it from a systems perspective. You look at biology and particularly epigenetics, how stress gets under the skin and really significantly impacts. When you're looking at behavior, food choice is important, not just food choice, but food insecurity. You're looking at poor sleep, school start time. I know California passed a bill whereby you can, start school later. That all those things are important, and stress and the like, as well as psychosocial stressors are critical, and environmental factors as well. And I think that's one area that is untapped. Exposures to toxins, environmental toxins, not just air quality and the like. And I think in many ways, that's what I think has contributed, because we've turned the dial up on all of those potential risk factors, making mental health more endemical.
Thank you. Thank you for that. And do we have another question before? Oh, there we go. Yes. Hi.
Thank you. So you mentioned earlier just this, I'm a real fan of seeing the increase in the billing for the mental or the telemental health. It's actually the highest billing of all the telehealth codes. And I think it makes so much sense. But to the conversation we had earlier around connectivity, we see a real problem with getting mental health access in the privacy of your home for our residents who don't have connectivity. Mm-hmm. Are you seeing that? And what are your solutions for trying to get the kids who need it but don't have connectivity in their home?
That's a great question. That's a big issue, just overall not having the connectivity. Most of the kids that I'm seeing, just because we're on the peninsula, they don't have problems with that. But I have some kids who maybe not connectivity at home, but they have a phone. They'll go to their car during a free period at school and do a session with me. It's a little easier for me because I'm doing just med management. I have a few therapy cases, but they're like 20 minutes, so it's easy to kind of step out of school. So to get the privacy like that is important. But yeah, it's a huge issue just in general. Everything's on the internet. Like you can't even do school without connectivity, right? Most of the time. So I don't have the answer to that. But it is a huge challenge.
May I answer that, please? Yeah, so I think this is where Katherine and I are teaming up. So what we've done here at the Media Innovation Lab, we've partnered with companies like Amazon and T-Mobile to address the digital divide. So we created a remote health monitoring solution whereby we send an iPhone to people's homes as well as a MiFi so that we can remove many of this. Now, the question is that sustainable? We're not sure, but we have to test it. And we're gonna have to, galvanize the entire ecosystem. Academics can't be doing this, which is why we love working with Dr. Grill, because with Dr. Grill, parents can now afford using a digital solution. It's a fraction of the cost to seeing a mental health practitioner. And at the same time, you get a 24-hour wraparound support that families need. So it's not only solving the issue of access, whether it be connectivity and the like, but it's really allowing us to do more, to really extend our tentacles in crevices and areas that we're unable to do so in many ways, whether or not if that's primary, additive, adjunctive, or augmentive. I think this is where we're testing different dissemination and implementation models for that.
Yeah, thank you. Thank you. So let's wrap it up with rapid fire question. What if everything worked in service of these kids? What if government worked, schools worked, mental health worked? What if we all work together? What is the North Star? What could be the future if we were able to meet the mental health needs of young adults today?
Yeah, from my perspective, working on the preventative end, I really am looking to have mental health be so normalized that it's discussed from early on. We just saw the panel about early childhood education, early on a daily basis with family, friends, peers, teachers in the school, the same way they're talking about math and science. So at some point, statistically, they're going to have a mental health issue, or somebody that they know is going to have a mental health issue. When that happens, it doesn't reach crisis level. They know right away who's a trusted adult, how do I reach out for help, and the access points are there. So for us, it's really working with them early on, but happy to hear what my colleagues think.
Great.
You want to go, Azizi? Or I'll go.
No, please, go ahead, yeah.
Okay. Wow. so much would have to happen. I think about access to care, in general. I mean, it's access to care for anyone. I mean, no matter your socioeconomic status, it's still hard to find a psychiatrist or a therapist. Much, much harder for lower socioeconomic patients. And the compensation, if you have like Medi-Cal, is very poor. And so a lot of clinicians just say, well, then I won't take Medi-Cal. So, which is understandable. If they have a private practice, they need to pay for their practice, but then there's no one to see these other kids. And so, and we have good community clinics, but I think there's so much to be done in terms of funding them better. We have the regional center in California, which is for autism, some intellectual disability, and they're state-funded programs, but they've been gutted with their funding. So I think, so a lot of it's money, and then getting people coordinating care better. Yeah.
Great, thank you. And Azizi, North Star, what will happen if all of these things work? What will we see in how the young adults are entering society after school?
Well, thanks again for the opportunity. I think my previous panelists, did a fantastic job. The only thing I would add is this, that our youth are important to us. They are treasures. And I truly believe that if we were to achieve this North Star, whereby we can increase access for all, good quality mental health care, we can have more robust, culturally tailored and appropriate assessments, timely interventions, wraparound supports for kids, teachers, and the entire community, that I truly believe that we'll be able to have a society whereby we no longer have any significant differences between the haves and the have-nots and the have-mores, particularly with mental health being one of those critical barriers so that kids are unable to achieve their full potential. And so this is the reason why we care about mental health so much. I came from, inner city Kingston, Jamaica, and I wish I knew what mental health was, because in many ways it was a survival of the fittest. But I've seen the unfortunate effects that it has had on me and my other folks. I was fortunate to get it out there. And if I were to just close my eyes, I can see, similar kids in Idaho or in Illinois, in Chicago, or here in Miami. And so if we are serious about ensuring that we provide the safest, best environment for kids so that they can reach their fullest potential, that this North Star means that we can not only focus on mental health, but now we can talk about these kids as innovators and our next generation of leaders. And so this is what is important, and that is what is at stake.
Yeah, we all have a responsibility to support the mental health of the next generation, because let's face it, they are the future and we kind of depend on them if we want to age in a healthy way. So with that, I'll just thank my panelists. Thank you very much. And thank you all.